Hi Barry, how you doing?
Well, I'm doing splendidly, thank you.
Where are you from?
Well, originally I'm from New York, and I moved here from Vermont 13 years ago.
And how did you get into doing the healing that you do?
I was a social friend of Howard Lotsoff, who was the man that discovered Ibogaine, and so I've been following the progress of Ibogaine for the treatment of addiction interruption, primarily with opiates, and have been, this is since the 1960s, and then I became involved with it on a personal level about 20 years ago, and recognized that it was a, excuse the hyperbole, pretty much a miraculous medicine, and I saw the evidence of the quality that it brought to people's lives, and including my own, and was basically invited by some of the earlier people involved in this work to join what was then a very small community, perhaps 40 Ibogaine providers in the world at that time. And I went through an apprenticeship and began treating people about 10 years ago.
What is Ibogaine and how was it used traditionally?
It was basically used for ceremonial purposes and as a rite of passage by peoples known as the Buiti, who occupy what was French Equatorial Africa. Again, is what has shown itself to be without peer in terms of both medicine and therapy, in terms of releasing people from substance addiction, but also from habitual patterns that are not working for them. It's kind of very much like a reset on a very deep level, taking you to the ground of your discontent, places of not feeling integrated.
I've heard that, for example, psilocybin is now under phase 3 testing for the FDA to be used for terminal cancer patients.
Yeah.
And you see that as related to the whole gamut of psychoactive substances. And one thing that was argued about this is that there is hope by a lot of people that this would not just be a medicinal treatment modality, but it would eventually be open to everybody who wanted to gain the experience.
Well, I can't really say. You've got the pressures of the pharmaceutical companies and the forces that would like to not see medicines which are intended to cure, but instead to keep people on profitable medications. And so there are those forces in the wind that wish to keep this kind of work, this kind of modality illegal or marginalized as much as they can. It's in their own best interest in terms of profitability to keep these modalities in the wings.
With the Ibogaine here, do you also use this for consciousness expansion beyond people that are addicted? And if so, how much of that happens?
About a quarter of the people that come here are involved in personal exploration, who have done an awful lot of personal work, who have been involved in meditation, and are looking to explore more directly their own life experience and be more integrated.
And what's your way of reintegration into the community after this?
Well, obviously, that depends upon what we're treating. Somebody who has been a long time opiate or polysubstance user, they need to illustrate a whole plan for changing their lives before we'll even accept them as patients. And we will help them set up a life course for themselves. For other people who are already involved in personal quest, they are likely to continue working deeply with their meditation practices or the other elements that have enhanced their lives. Treat every patient or every guest, as we prefer to refer to them, as people who are looking to make a fundamental change in their life. And in that regard, Ibogaine is extraordinary. I mean, you have in the world of Buddhism what they call the threefold logic of ground, path, and fruition. And the Iboga is definitely the ground. It does go to fundamental places that are not even within memory. In fact, are memories that have been blocked and need to be released in order for the emotional element of it to be released and allow people to feel more of a sense of integration.
Well, thank you very much, Barry. It's been a pleasure.
Well, it's a pleasure to see you, Don. Glad you could come over and we could have this conversation.